HIV stands for Human Immunodeficiency Virus. It is a virus that attacks the body's immune system. The immune system is our body's defense against infections. HIV weakens the immune system, making it difficult to fight off illnesses. AIDS stands for Acquired Immunodeficiency Syndrome. It is the most advanced stage of HIV infection. HIV is a global health challenge. It has affected millions of people worldwide. The virus can be transmitted through various means. These include unprotected sex, sharing needles, and mother-to-child transmission during pregnancy or breastfeeding. Understanding HIV/AIDS is crucial for prevention, treatment, and support. The impact of HIV/AIDS extends beyond individual health. It has social, economic, and cultural implications. Stigma and discrimination associated with the disease can prevent people from seeking testing and treatment. Access to healthcare, education, and support services is essential for effectively addressing the HIV/AIDS epidemic. HIV infection progresses through different stages. Each stage is characterized by specific changes in the body. The first stage is called acute infection. This stage occurs within 2 to 4 weeks of exposure to the virus. Many people experience flu-like symptoms during this stage. The second stage is called chronic infection. During this stage, the virus continues to multiply in the body, but at a slower rate. People in this stage may not have any symptoms. They can still transmit the virus to others. This stage can last for many years. The third stage is called AIDS. This is the most advanced stage of HIV infection. The immune system is severely damaged. People with AIDS are highly susceptible to opportunistic infections. These infections are rare in people with a healthy immune system. Early symptoms of HIV infection can be similar to flu-like illnesses. These symptoms may include fever, headache, fatigue, sore throat, swollen lymph nodes, and a rash. These symptoms can last for a few days or weeks. Not everyone experiences noticeable symptoms during the early stages. As HIV infection progresses, it can lead to various symptoms and health complications. These may include persistent fever, night sweats, weight loss, diarrhea, skin rashes, and fungal infections. The virus weakens the immune system, making the body vulnerable to opportunistic infections. Opportunistic infections are infections that occur more frequently and severely in individuals with weakened immune systems. Common opportunistic infections associated with HIV include pneumonia, tuberculosis, candidiasis, toxoplasmosis, and certain types of cancer. Testing is crucial for diagnosing HIV infection. Early detection allows for timely initiation of treatment and prevention of transmission. There are different types of HIV tests available. These tests detect the presence of the virus or antibodies produced by the body in response to the infection. Antibody tests are the most common type of HIV test. These tests detect the presence of antibodies in the blood or saliva. It takes time for the body to produce antibodies after infection. Most antibody tests can detect HIV antibodies within 2 to 8 weeks after exposure. Antigen antibody tests can detect both HIV antigens and antibodies. Antigens are foreign substances that trigger an immune response. These tests can detect HIV infection earlier than antibody-only tests. Nucleic acid tests, or NATs, directly detect the presence of HIV in the blood. NATs are very accurate but also more expensive. Section 5. How HIV spreads. Understanding the routes of transmission. HIV is transmitted through specific bodily fluids. These fluids include blood, semen, vaginal fluids, rectal fluids, and breast milk. The virus can enter the body through cuts or sores in the skin and mucous membranes. It can also be transmitted through sharing needles or syringes contaminated with HIV-infected blood. Sexual contact is a major mode of HIV transmission. Unprotected anal or vaginal sex carries a high risk of transmission. Oral sex also carries a risk, but it is lower than anal or vaginal sex. The risk of transmission increases if there are sores or bleeding in the mouth, genitals, or rectum. Mother-to-child transmission, or MTCT, can occur during pregnancy, labor and delivery, or breastfeeding. HIV-positive mothers can transmit the virus to their babies if they are not on antiretroviral treatment. Treatment can significantly reduce the risk of MTCT. Section 6. Preventing HIV transmission. Effective strategies for staying safe. Preventing HIV transmission requires a multifaceted approach. Education, awareness, and behavioral interventions are crucial. Abstinence from sexual activity is the most effective way to prevent sexual transmission of HIV. However, for those who are sexually active, there are effective prevention methods available. Consistent and correct use of condoms is highly effective in preventing HIV transmission during sexual activity. Condoms act as a barrier, preventing the exchange of bodily fluids. It is essential to use condoms correctly and consistently every time you engage in sexual activity. Pre-exposure prophylaxis, or PrEP, is a medication that can prevent HIV infection in people who are at high risk of exposure. PrEP involves taking a daily pill that contains antiretroviral drugs. These drugs work by preventing HIV from establishing infection in the body. Section 7. Living with HIV, Treatment and Care for a Healthier Life. Advances in medical science have transformed HIV from a fatal disease to a manageable chronic condition. Antiretroviral therapy, or ART, is the cornerstone of HIV treatment. ART involves taking a combination of medications that suppress HIV replication in the body. ART helps to restore the immune system by reducing the amount of HIV in the blood. This reduces the risk of opportunistic infections and HIV-related illnesses. ART also helps to prevent HIV transmission to others. People living with HIV can live long and healthy lives with proper treatment and care. Living with HIV requires ongoing medical care and support. Regular medical checkups are essential for monitoring the virus, managing side effects of medications, and addressing any health concerns. Support groups and mental health services can provide emotional and social support. Section 8. The global impact of HIV/AIDS. Statistics and trends. HIV/AIDS continues to be a major global health issue. According to the World Health Organization, an estimated 38.7 million people were living with HIV globally in 2023. The HIV/AIDS epidemic has had a profound impact on societies worldwide. Sub-Saharan Africa remains the most affected region, accounting for a significant proportion of new HIV infections and AIDS-related deaths. However, progress has been made in recent years in reducing new infections and improving access to treatment. Despite the progress, challenges remain in achieving global HIV/AIDS targets. These challenges include ensuring equitable access to testing and treatment, addressing stigma and discrimination, and developing a vaccine and a cure for HIV. Section 9. The importance of HIV/AIDS. Awareness and education. HIV/AIDS awareness and education are essential for prevention, testing, and treatment. Comprehensive sexuality education should be provided to young people. This education should cover topics such as HIV transmission, prevention methods, and the importance of testing. Public awareness campaigns can help to dispel myths and misconceptions surrounding HIV/AIDS. These campaigns can promote accurate information about the virus, how it is transmitted, and how to protect oneself and others. Reducing stigma and discrimination is crucial for creating a supportive environment for people living with HIV/AIDS. Stigma can prevent individuals from seeking testing and treatment, leading to further transmission. Section 10. Combating stigma and discrimination. Creating a supportive environment. HIV/AIDS stigma and discrimination can manifest in various forms. These include negative attitudes, beliefs, and behaviors towards people living with HIV or perceived to be at risk. Stigma can lead to social isolation, discrimination in healthcare, education and employment, and even violence. Addressing stigma requires challenging misconceptions and promoting empathy and understanding. Educational interventions can help to dispel myths and provide accurate information about HIV/AIDS. Creating a supportive legal and policy environment is essential. Protecting the rights of people living with HIV/AIDS is crucial. This includes ensuring access to healthcare, education, employment, and social services without discrimination. Creating a supportive environment encourages people to seek testing, treatment, and support. Section 11. The future of HIV/AIDS, research, innovation, and hope. Scientific research continues to make significant strides in the fight against HIV/AIDS. Ongoing research focuses on developing new and improved treatments, finding a cure, and developing an effective vaccine. Advances in gene editing technologies hold promise for potentially curing HIV. Gene therapy approaches aim to modify the genetic material of HIV-infected cells to eliminate the virus or make the cells resistant to infection. The development of a safe and effective HIV vaccine is a major global health priority. A vaccine could potentially prevent new infections and help to end the HIV/AIDS epidemic. Collaborative efforts are underway to accelerate vaccine research and development.